Thank you, Gabriel, and thank you everyone for joining us today. Last week's forecast was mostly sunny with storm clouds on the horizon. This week it's raining, and it looks like there may be some unseasonably rough weather ahead. After our large fall and winter third wave, the decline in new cases we were celebrating stopped abruptly in mid-February, and cases have been increasing again since early March. Over the past week, 200 new cases were reported daily, that's up 43% from 2 weeks ago when the latest rise began. Our 14-day incidence rate is 108 per 100,000 residents, and that's up 26% from its trough after the third wave in early March, and up 18% over the past week. Incidence rates are increasing among all age groups except for ages 75 and older, and younger age groups have seen the sharpest increases in the last couple of weeks. Among adults 75 and older, COVID-19 cases continue to decline due to high vaccination coverage. The case rates in this group, the 75 and older group, have dropped 83% since February the 1st and have remained at the lowest rate among all age groups throughout March. This is a tremendous testament to the effectiveness of our vaccines. The rate in the 75 and older group is approximately 1/5 the rate in 18 to 24-year-olds who have the highest current rate of infection. Overall, COVID-19 incidence is the highest currently in cities in South and Southeast King County, including Covington, Enumclaw, Auburn, Kent, and Federal Way. Now, let me tell you a bit about hospitalizations. Last week, 51 King County residents were hospitalized with COVID-19. That's a 25% increase from the prior week and represents one person hospitalized about every 3 hours and 20 minutes in King County. The most recent increase over the last few days is primarily among 40 to 69-year-olds. And again, this is a reflection of the decrease in hospitalizations among our oldest adults. However, the number of hospitalized cases last week is still much lower than what we experienced during most of the fall and winter surge. It's about 1/6 of the peak we experienced during that surge. Deaths have also been decreasing since the peak of the fall and winter surge. And over the past week, one King County resident has died of COVID-19 every 12 hours, or 2 new deaths daily, which is about 1/4 the number during most of the recent peak. I'm sorry, let me restate that. The number of King County residents who are currently dying of COVID-19, 1 every 12 hours, is about 1/4 the number of the most recent peak during the fall and winter surge. The good news is that despite increasing COVID-19 transmission, our oldest, most vulnerable adults are now largely protected through vaccination. And this will help keep the number of hospitalizations and deaths much lower than would be expected in the absence of vaccine. So for this reason, over time, we'll see the burden of hospitalizations shift to younger age groups until more younger people can be vaccinated. Now, with respect to the variants of concern, Washington State continues to sequence more isolates, and with that, we identify more variants of concern. We've had additional variants of B.1.1.7 recognized since last week, and then 2 new variants of concern were added to CDC's list of variants of concern. And we've identified over 100 cases, almost 200, with the B.1429 variant and 19 cases with the B.1427 variant. And these were first identified in California and are very prevalent along the West Coast. So in summary, we're seeing a clear trend now of rising COVID-19 cases and hospitalizations over the past 2 weeks. At the same time, deaths remain stable and low compared to recent peaks, largely as a result of high rates of vaccination of our older adults. It's important to note that these increases occurred before we transitioned to phase 3, which will now further increase our activities and opportunities for the spread of COVID-19. At the same time, more contagious variants that cause more severe infections are increasing, and I think there's a good chance we're looking at the beginning of a 4th wave. What I can't predict is how big it will be and how much damage it will cause. A new surge will more likely primarily affect younger age groups who have lower risk for hospitalization and death than older adults, but who can suffer from serious infections. A few weeks ago, when we entered phase 2, I said we were skating ahead without knowing how thick the ice was. Now, as we enter phase 3, we're going to find out just how thick the ice is. And it looks like it's beginning to crack a bit beneath us under the combined weight of more contagious variants and more activity. Whether we fall through the ice or skate safely around the dangers depends on our behaviors, on what we do as a community over the coming weeks, as we are challenged by more infectious variant viruses that can cause more serious infections. Unless we increase actions to limit the spread of COVID-19, we should expect cases to continue to increase. Hospitalizations and deaths may also increase to a lesser extent that's hard to predict. And they will be countered to some degree, given the increasing numbers of people who are being protected through vaccination. So, as I've tried to impress on everyone over the past few months, until enough of us are vaccinated, it remains critical to continue to take steps to prevent the spread of COVID-19 where we work, where we socialize, in our personal lives, in our homes, and anywhere people gather. And these new variants and more activity means we need to do better in the coming weeks than we've been doing recently. I want this outbreak to be over. It's been like a very bad dream. But unfortunately, it is not a dream and it won't go away unless we work together to make that happen. We've endured much over the past year, but we need a few more weeks of serious effort to finish this off successfully. We can't let the light at the end of the tunnel blind us. Giving in and relaxing prematurely will lead to additional preventable illnesses and suffering. COVID-19 is now a vaccine-preventable disease, and we just need to keep our guard up until more of us can be vaccinated over the coming weeks. It's important to prevent COVID-19 in all ages, not just older age groups. According to the National Institutes of Health, large numbers of people with COVID-19 continue to experience symptoms long past the time they've recovered from their initial illness. Often referred to as long COVID, these symptoms can include fatigue, shortness of breath, brain fog, sleep disorders, fevers, gastrointestinal symptoms, anxiety, depression, and they can persist for months and range from mild to incapacitating. What we need to do is not complicated. Wear a well-made, snug-fitting face mask. Limit activities with unvaccinated people from outside your home. Avoid crowds and crowded indoor spaces. Pay attention to improving ventilation in workplaces, businesses, and homes, including by opening doors and windows. Remember how COVID-19 spreads through the air and often from people who do not appear to be ill or before they develop symptoms. I know it's spring break time and people may be traveling or thinking of traveling. If you do travel, know that travel at this time presents a significant risk for COVID-19. Many areas of the country have substantial or increasing COVID-19 transmission and increasing numbers of the more contagious variants of concern. To protect your health and the health of those around you, if you do have to travel, get tested 1 to 3 days before your trip and do not travel if positive, but isolate away from others. After travel, get tested in 3 to 5 days after your trip and stay home for 7 days. If you don't get tested, quarantine at home for 10 days. Now let me turn to an update on vaccine. Over 600,000 people in King County have received at least one dose of vaccine. That's 33% of King County residents age 16 or older. 18% of King County residents 16 or older are fully vaccinated. Among our older adults, and this is why we're seeing hospitalizations and deaths plummet in this older age group, 87% of residents 75 and older have received at least one dose, and 82% of residents between 65 and 74 years of age have received at least a dose. Geographically, every region of King County has surpassed the 70% vaccinated benchmark for residents age 65 and older. Now, Although communities of color have had the highest rates of COVID-19 cases, hospitalizations, and deaths, our vaccination rates among Black, Hispanic, Latinx, and Asian Americans continue to lag behind that of white King County residents. However, we're working hard to close these gaps. As of this week, adults aged 65 and older across all racial and ethnic groups have surpassed the 70% vaccinated benchmark, except for our Black and African American residents, who are close at 67% receiving at least one dose. We continue to work toward closing these race and ethnicity gaps through targeted outreach, community events, encouraging providers to conduct outreach to established patients of color, and other strategies. Here's a few ways we're doing that work this week. Our high volume sites in Auburn and Kent have delivered over 51,000 doses of vaccine, with a focus on older adults in South King County, hard-hit communities. 48% of clients seen at these sites identify as people of color. We're continuing to provide vaccine education materials tailored to help communities of color and people who do not speak English as a first language to make informed decisions about COVID-19 vaccination. For example, this week we worked with community navigators to release public service announcements for childcare workers about vaccine eligibility in 6 languages. Our community vaccination events continue. There are small vaccination events put on in partnership with community-based organizations serving BIPOC residents. These events serve as a critical access point to reach people who may face barriers accessing vaccine at our high volume sites or through other providers in the healthcare system. Recent events include a clinic serving the Khmer community in Federal Way, a City of Seattle clinic in South Park for Latinx residents, and upcoming events are planned for Burien and Seattle's Central District. And before I go to the Q&A session, I want to also remind everyone that we continue to face a big and growing gap in vaccine supply and demand. Starting on March 31st, we anticipate upwards of 430,000 additional King County residents becoming eligible for vaccination. And when added to those people who are already eligible, a total of over 1 million residents may be eligible. We're looking at an estimate of 1.2 million. As of March 24th, almost 600,000 residents have received a dose, leaving 605,000 vaccine-eligible residents who will still need to start a vaccination series. So we anticipate vaccine dose supply to remain stable over the next several weeks. No increase in supply, relatively stable, but increasing eligibility. So for example, next week, we expect providers to receive about 36,000 first doses. And our best information suggests that federal programs with pharmacies and community health clinics may bring in another 23,000 first doses. And although we don't get exact figures on how many they get or how much of that supply stays in King County, we're looking at probably around 50,000 first doses, ballpark. If we include the estimated federal supply, that would mean we could get one first dose for every eligible 10 residents who have not yet started vaccination. So clearly, 9 out of 10 will not be able to access vaccine in the next week who are eligible for vaccine. So again, we're asking everyone's patience and understanding. We're working to get the doses out to the community just as quickly as we get them from the federal suppliers. And we do know that the vaccine supplies are going to increase significantly in April, but at this time, they remain very limited compared to the number of eligible. But when that supply increases, we're ready to expand our capacity to distribute those vaccines quickly and effectively. So in closing, for my comments, let me say that we may be close, but this outbreak is not over. And the virus is trying harder than ever to make a comeback. In King County, of all people, the 12s should know better than anyone not to celebrate before we're in the end zone. And we need to remember that now. So with that, I welcome your questions and a nice dialogue with you today.
Thanks so much, Dr. Duchin. And just a reminder, members of the media with questions, please use the raise your hand function in Zoom. And time permitting, we'll also include some questions from community, from folks watching the Facebook live stream. So to get underway, our first question from Jessamine McIntyre. Jessamine, you are on deck.
Hi, Dr. Duchin, and thank you, Gabriel. Appreciate your time. I've got a two-parter for you this Friday. This morning, Mayor Durkin told Q13 that she thinks that things have become too confusing when it comes to getting the vaccine and that all adults need to be eligible now while prioritizing those that are most at risk. Do you think now is the time for that? And also, who gets priority for leftover shots at King County's vaccination sites? Is there a wait list, or do they go to volunteers or these so-called vaccine chasers who wait outside?
Okay, first part of the question, should the vaccine eligibility be open to all adults 16 and older? That would only make our situation worse, in my opinion, exacerbate the gap between supply and demand. Washington State does make the eligibility criteria for our entire state, and they've been working very hard to try and have those criteria be informed by equity and trying to ensure that initially those older adults and our frontline healthcare workers have access first, and then subsequently stages that are formed by equity related to both communities that have been hardest hit, but also workers that have been hardest hit and who have been on the front lines doing essential services and so on. Those groups do now, as we increase eligibility, what that happened this week and that will happen March 31st, those new eligibility criteria will include many younger adults. However, I think increasing the eligibility to all adults would not only further exacerbate the discrepancy between supply and demand, but I think it would make potentially exacerbate inequities in vaccine distribution, because we know that people who have more resources and who are more savvy about seeking vaccine are able to acquire it more readily, and that would potentially further disenfranchise some of the communities that are already under-vaccinated and having difficulty accessing vaccine. So that's my personal opinion on that. With respect to how our King County sites deal with leftover vaccines, I think the best thing would be to send you a copy. I don't have it with me, but a copy of the guidelines that we have for all sites for using vaccine. I don't know if I can tell you how each site is prioritizing use of leftover doses at the end of the day, either doses that are from people who've canceled appointments or not shown up, or unanticipated extra doses that have been extracted from the vials of vaccination. I do know that they're trying to use equity-informed principles. They have wait lists of people who meet criteria, but who are not able to make appointments that get called. And they in general, should not be accepting, walk-ups. So I think that there may be some variation from site to site. So we can get you this exact protocol that each site is using.
Thank you.
Thanks so much, Dr. Duchin. Our next question comes from C.E. Bick. Please go ahead.
Hi, yes, thank you so much for taking my question. I appreciate it. I wanted to ask, I realize that public health doesn't ultimately control what King County Corrections decides to do, but given that at least 50 people in the downtown Seattle jail location have tested positive for COVID, and public health does issue recommendations for the corrections department to follow, is public health going to be issuing more stringent guidelines for jail masking, cleaning, distancing, etc.? I ask because from my understanding, based on my past reporting of other outbreaks, nothing much has changed within the jail sanitation-wise, even though these outbreaks keep happening.
Yeah, thanks for your question. We do provide detailed recommendations whenever we evaluate an outbreak, and that was done in the case of this current outbreak as well. I think whenever possible, and I do believe in this case as well, we have people on site to assess in person, what the risk factors may be for transmission and tailor the guidance to be appropriate to that particular situation. So I can't say we would be issuing more stringent guidelines. I mean, we would be issuing the guidelines that are appropriate. Now, how those recommendations get enacted, we don't always have control over, but we do issue the best guidance we can based on the information that we have about the outbreak and the information that we have about control of COVID-19 transmission based on information from the Centers for Disease Control and Prevention and any relevant guidelines from Washington State.
Great, thanks so much. Our next question comes from Chris Daniels. Chris, please go ahead.
Hi, Dr. Duchin. I just wanted to follow up on that question that Jessamine asked off the top, and then I have another question as well. So I understand the reasoning that you gave for not speeding up the vaccine distribution in phases. But what is the difference in Washington State and in King County between what you're doing here and California, where they just announced that the vaccine will be open to all April 15th, and also additional large populated states have made similar announcements. I mean, what is the difference? That's the first question. The second question, why no fixed vaccination sites on the north end of the county? We're hearing Shoreline and North Seattle are wanting a fixed vaccination site, but haven't been able to make that happen.
Mm-hmm. Yeah, so with respect to the first question, again, I think Washington State is trying to be very intentional about equity in the vaccine rollout. And I think if you look at at least I can speak for King County, if you look at our vaccine equity, if you go onto our dashboard and look at who's been vaccinated, the relative rates of vaccination in the various racial and ethnic groups, you'll see gaps there, but you'll see that those gaps, I believe, are narrower, and there's less disparity than you find in many of the states where it's a free-for-all. So we are trying to be intentional about rolling out vaccine in a way that allows those who are at highest risk of severe illness, hospitalization, and death to have access and earlier, and those at lower risk to be subsequently prioritized. Now, there's no perfect solution to this terrible dilemma of having many people who need vaccine, deserve vaccine, want vaccine, and relatively little vaccine available at this time. There's no way to do this perfectly, but I think that Washington State is trying to be very intentional, and that's why you see the sequential eligibility. Now, they have accelerated that quite a bit, and if you, I encourage you to look at the latest version of the allocation criteria, which do include eligibility for lots of younger people, but they're trying to make that access available preferentially in those younger people who've been on the front lines, essential workers, people in congregate settings who are at higher risk for transmission and so on, as opposed to just anybody who happens to be in that age range. So I think the difference you'll see is that I believe that Washington State, and particularly I can speak for King County, through this this prioritization scheme, as uncomfortable as it's been, as difficult as it's been, as frustrating as it's been, is successfully addressing the challenges in equity and minimizing, or at least I think what we're seeing are fewer inequities than we would see in a free-for-all situation, in a first come first serve situation. Let's see. Well, did you have a two-part question?
Yeah, the second question concerns the north end of the county.
Oh, right, yeah. Got it.
We're just talking about fixed vaccination sites, mass vaccination sites.
And again, so North County. So again, if you look at North County, you'll find that disease rates are relatively low. Vaccination coverage rates are very relatively high. So it's not that North County is a neglected area. We are working though to provide another site in North County with various community partners, and we think that's going to happen. But it was not a priority need compared to some other parts of the country where disease rates were much higher and vaccine access was much lower.
Great. Thanks very much, Dr. Duchin. Our next question is from Tammy Mutasa. Tammy, please go ahead.
Hey, good afternoon, Dr. Duchin. Thank you so much for your time, as always. It's like you were reading my mind today, because we're looking ahead to the first phase 3 assessment on April 12th. And right now I see that our cases and hospitalizations in King County do meet the criteria to stay in phase 3, but the transmission rate is at 1.5, which is above that one number we want to be at. So when was the last time this happened? And What do you attribute that to? And if our friends want to have a house party this weekend to celebrate spring, what do we say?
Okay, I thought you were going to say I was reading your mind about the 12s and not celebrating before we're in the end zone. I hate to remember that moment, but that's really what we're looking at. We're celebrating a little early right now. So when was the last time we were in a situation like this? We've never been in a situation like this. This is one of the things about an emerging pandemic with a new pathogen. I mean, we don't have a lot of experience to go on. We try and learn over time, but things evolve, things change. There's just a lot of dynamic moving parts. So we have not had a situation like what we're facing now previously. What we have now is increasing availability of vaccine, which is dramatically going to alter the way this virus affects our human population. And we have increasing new variants of concern, which are more transmissible and cause more serious disease, which you haven't had previously. So these are two big new unknowns that are simultaneously impacting our population. I think, and so yes, you're right. We're entering phase 3. We're seeing opportunities now for larger gatherings, for more liberalization on, what types of things we can do in the community, higher occupancy rates. At the same time, we're seeing cases go up. We're seeing hospitalizations go up. We're seeing more contagious variants becoming more popular. What this means is that if we're going to be successful in decreasing the number of cases and preventing the avoidable illnesses from happening now, again, younger people will recover from COVID uneventfully. But when you're talking about tens of thousands or hundreds of thousands of people becoming infected, even a small proportion of that who develop severe illness, hospitalization, death, or long COVID is a lot of people. And that's a lot of suffering that I would like to avoid. And I think anyone who's known someone with COVID and knows what it's like would not want to wish that on their friend, family member, coworker, or anyone in the community. So I think we all want to do whatever we can. We will need to do whatever we can to turn this around. And we know that, again, what we're looking at today, our effective number that you mentioned being above 1, that's from several weeks ago. Everything we're looking at today is based on what people did a few weeks ago, or at least 10 days ago. Hospitalizations longer, deaths even longer than that. So what we need to understand is that whatever we do, it's going to take a few weeks to turn around, and that we need to do a lot better in the coming weeks than we did in the past couple of weeks. And that means, limiting our activities, despite the fact that they're permitted in phase 3. If we want to turn this around and minimize disease, we need to take personal responsibility and remember to do less, to wear masks at all times and around people outside the household, in indoor air spaces, to avoid crowds, to avoid prolonged close contact with others without masks on indoors, to take all the precautions that we know will work. We saw some of the effect after the peak of the third wave, when we started to come down again. But it will take a serious effort, and it's going to take a more sustained effort and a more rigorous effort, because these viruses are just harder to stop. They spread more readily, and they cause more severe infections. So it's not something that we'll need to do forever. It's just for a couple of weeks, 6 weeks maybe. As we get more and more younger people vaccinated, the threat will, continue to recede. But at this point, we're looking at the very rapid spread of new variants and a lot of activity in the community that's going to facilitate that transmission. And so we should expect cases will increase unless we do something about that. And I think we know what to do. We just need to do it.
Thanks, Dr. Duchin. And we have time for just one more question. That's from Sandy Doughton. Sandy, please go ahead.
Hi there. Thanks so much for these ongoing briefings. They're really helpful. Now, forgive me, I came in a little bit late. If you've already addressed this, you just mentioned the rapid spread of new variants. Do you have an estimate of the % of new cases in the county that are being caused by these variants? And a second part is, there's new modeling out of the Hutch that suggests the importance of super spreader events and allowing these variants to take hold. So I'm wondering if you're seeing any evidence of that going on.
Oh, thanks, Sandy. So with respect to the first part of the question, so Washington State is now sequencing about 6% of all COVID-19 cases. And that's one of the higher percentages in the entire country. So they're doing a fantastic job, along with, this is a group effort with the public health laboratory, as well as University of Washington and other laboratories who have sequencing capacity. So this is great. But 6% is 6%. So we don't have a standardized, population level methodology that would allow us to predict exactly how many, what proportion of cases are due to these new variants with any precision. But we are detecting in a sort of non-sophisticated, non-standardized sampling scheme, we're detecting increasing numbers every week. So based on that, I think some computational evolutionary biologists can make some calculations about when they think these variants will become the predominant strains, and those estimates have been made, and they're looking at, sometime in March or maybe early April. Those are estimates, though, and we can't tell you precisely what proportion of isolates at this point are due to the variant strains. And we may evolve our testing methodologies so that the variants are more easy to identify with less intensive lab testing without sequencing. But at this point, we can't say for sure what, the exact proportion of isolate of cases that are due to variant strains. With respect to super spreading, this has been recognized from the get-go of this outbreak that certain people are very effective at spreading COVID-19. The Skagit choir outbreak is a perfect example, and one of the earliest examples of clear airborne transmission, where this large choir practiced, one person was infected, didn't know it, and many people in that choir who had no close contact, but who were in the same choir practice room became infected. So airborne transmission from someone who didn't know they're infected and to a very large number, those are the super spreading events. We know that happens. What we can't predict is who's going to be a super spreader, in particular, because these events happen before someone develops symptoms. So it's not even that the person's been tested yet to know they even have COVID when they're doing their super spreading. Primarily, transmission occurs before people get tested, either in the asymptomatic or pre-symptomatic period, or the early time before they're tested and the result is back. So what we have to do is then look at what are the environments that could promote a super spreader event. Super spreader events don't happen with small one-on-one encounters. Super spreader events don't happen with small group gatherings. Super spreader events happen where lots of people come together, and particularly where large groups come together in areas where ventilation is not good, enclosed air spaces, indoor air spaces. So the advice is, right now in particular, but has been all along, avoid crowded indoor settings, avoid places where people are indoors without their masks on for prolonged periods. Well, I would say avoid places where people are indoors without their masks on, period, but certainly avoid places where people are indoors for prolonged periods in crowded indoor air spaces. So if we avoid the types of settings where super spreader events can occur, that will minimize the risk, because we don't know in any setting if there's someone in there who's infected, if they're a pre-symptomatic, asymptomatic spreader, breathing virus into the room. And we know things like speaking loudly, speaking loudly, coughing, shouting, singing, vigorous exercising, put out lots and lots more viral particles that remain suspended in the air. And over time, they can build up, other people can inhale them and become infected. So brief encounters with masks are lower risk, but any longer term encounters, indoor air spaces, no masks, these are the types of things that promote super spreader events. And we would advise people to try and minimize those types of activities until we're all vaccinated.
Thanks, Dr. Duchin. We are going to have to wrap up today's briefing. Thank you for everyone who was able to attend. And if we weren't able to get to your questions, our apologies. Please go ahead and follow up with the PIO group. Dr. Duchin, anything you'd like to leave us with?
Yeah, as some of you know, I participate intermittently with certain activities of the National Academies of Science, Engineering, and Medicine, particularly the National Academy of Medicine. And if you've ever been to the National Academies of Medicine or you've looked at any of their publications, you may be familiar with their motto, which is both emblazoned on the walls of most of the meeting rooms, but also on the front matter of every publication that they produce. And it's a quote from Johann Wolfgang von Goethe, the philosopher, author, poet, playwright, and so on. And that motto is the following: knowing is not enough, we must apply. Willing is not enough, we must do. And I can't think of any more appropriate words for our community today than knowing is not enough, we must apply. Willing is not enough, we must do. If we heed those words and we remember, don't celebrate before you're in the end zone, we can get through these next few weeks as more and more of us become vaccinated and the risk of COVID-19 recedes. But if we don't, if we continue to do too much too fast right now, we will see, I think, an increasing number of preventable COVID-19 cases and their sequelae. And only time will be able to tell how damaging that will be ultimately to our community. So thank you. I appreciate your joining us every week. It's a little bit like Groundhog Day, I know, but I look forward to these sessions. I hope you do too. And I look forward to seeing you next Friday.